Hello, dear friends. I am Dr. Ritu Bhatia. I practice as interventional cardiologist in Pune. Today, we are going to talk about the modifiable risk factors for heart disease. We all know that heart disease is exponentially increasing in our subcontinent. This we being more prone to cardiac disease actually came to notice almost or more than 60 years back. There was a paper publication in American Heart Journal from Singapore that the Indians who were staying in Singapore vis-a-vis Chinese population, we had 4 to 5 times higher risk of coronary artery disease. So from there on, we started understanding that our population is definitely more prone for cardiac diseases. Now, when we talk about cardiac diseases risk factors, there are few modifiable risk factors, there are few non-modifiable risk factors. Non-modifiable means you already have a family history of cardiac illness, so it's in your genes and it's not easy to change that. A particular age, one as you age, your chances of getting that coronary artery diseases keep on increasing. We can't do anything about that. About sex, males, females up to menopause are lesser prone to have cardiac illness. So males are more prone as compared to females up to a particular age. But there are few modifiable risk factors. So when we talk about modifiable risk factors, we talk a lot about lifestyle modifications. Now, what I'm going to talk, I think most of us know about it. I'll just try to highlight few scientific facts or the background of that lifestyle modification advocated by us. And please feel free to put questions in the chat box, and I'll be very happy to answer them. Now, when we talk about lifestyle modification, the first thing which is very high in hierarchy as to a cause of coronary artery disease is smoking. So whosoever is smoking either a cigarette or is consuming some tobacco, some form of nicotine, is subjecting himself to a significantly higher rate of having a coronary artery disease. Though for a non-smoker like us, it's very easy to say that it's a modifiable risk factor, you should quit it. But people who have been smoking for years together, it's not that easy. We understand that. But having said that, with our experience of more than 20 years, we have realized that people who try to cut down on smoke over, they promised me that they'll be smoking like with 6, they'll get back to get down to 3 cigarettes in a day. It doesn't work that way. So the success rate is maximum when you decide, when you very strongly in your mind you want to quit, and you can abruptly quit. There would be inform your family members, there are going to be some withdrawal symptoms. You could be a little cranky, you could get constipated. Please address those issues or discuss those issues with your family members, with your treating physician. If it is, the initiative is taken collectively, the chances of you succeeding to quit smoking is. So try to increase the ingestion of vegetables and fruits, try to increase the protein intake, try to cut down on carbohydrate and fatty stuff. When we talk about fat, there's a lot of question, to ask to us which oil is good. So generally, when we talk about dairy products also, they should be low fat or skimmed milk or that kind of low dairy product, and it should be lesser of saturated fatty acids and more of unsaturated fatty acids what you consume. So oils like sunflower oil, olive oil or rice bran oil are little better than other kind of oils. Talking about sedentary lifestyle and functionality, it's always better to be physically more active. Try to have at least 30 minutes of brisk walk or some kind of cardio exercise every day. If your work schedule doesn't permit that, if you're commuting a lot, it might be possible that you don't get any time for yourself. So you can have like 75 minutes of aggressive physical activity on weekends. You could hit a gym, you could play a sport, uh, and at the same time, try to be lesser on screens, lesser on computers if possible. If your work demands that, that's different, but for fun, it's better to have outdoor activities rather than indoor activities. Sleep is again extremely important. You should or try to get at least 7 hours of sleep. That is a stress buster, and you should be adequately well rested at night to have best outcome the next day. Then stress. I just mentioned the role of sleep in reducing stress. Having a hobby, having a break from your regular routine, some kind of meditation, yoga, or whatever works best for you. You should definitely try to inculcate those hobbies as well. Something which relieves your mind of all the anxieties of day-to-day life. Pollution is coming in a big way as a new risk factor for even coronary artery disease. So try to keep yourself well covered when you are driving, or when you are when you are exposed to pollutants of any kind. Now, I think I have tried to cover most of the risk factors, and if you have any questions, please feel free. Having a regular visit to your doctor every year after 40 really makes sense. You should keep your hypertension under control. If you are diabetic, diabetes under control. Try to look at your cholesterol level, lipid profiles, and if your lipid profile is not good or your sugars are not controlled, try to work very sincerely towards that. That will probably definitely help you in a longer run. Thank you so much.